How many more breakdowns am I going to have before you guys finally acknowledge that, people need help?
After an FSJ mother shared her daughter's struggle to receive medical treatment, others are now responding with similar complaints. Katie Kuzma, a 25-year-old who struggles with anxiety, depression, and ADHD, says Northern Health has been nothing but an added stress.
It's frustrating. God, it's frustrating.
Katie says her biggest issue is it's impossible to book in for lab work, and when she does get in, her results are almost always delayed. And for someone who needs lab work in order to get the medication she needs, Katie is left feeling disregarded by the very people who are supposed to help her.
Booking a lab appointment is impossible at this point. I don't know why. COVID has everything screwed up. You have to book your appointments, and it used to just be walk in, get your poke, and walk out. No problem. Wait 5 hours to do so sometimes, but walk in, walk out, get your poke.
After hearing these concerns, Northern Health says yes, COVID has played a huge part in why things have been delayed or backlogged.
When we reopened after Wave 1, which was around May or June, we had substantial wait lists, largely in terms of lab, because we then had to also, on top of that, go to booked appointments. We could no longer have 20, 30 people in a waiting room waiting for lab work because we did not want our health facilities to be a source of transmission.
D. Smith saying our geographical area and population does play a factor in what resources we have compared to more densely populated areas like interior health, for example. But in saying that, D. Smith says we also have local services that are harder to come by in those highly populated areas.
Surgeries or those types of things, there may be extensive wait lists in other communities, but in a number of our communities, there are minimal wait lists for some of our services.
CJDC also spoke with MLA Dan Davies about the issue, who said this isn't just a Northern Health problem.
This is a Ministry of Health issue. We're under-resourced, especially in more rural, more northern, remote communities. We need more doctors. We need more nurses. We need more mental health practitioners.
Davies says we need to continue to pressure government to dedicate more local resources to our health care, and Kuzma agrees. She says it's an across-the-board problem that could have deadly consequences if things don't change quickly.
Not just people with substance addictions and stuff like that. It's literally everybody needs a little helping hand once in a while.
Hannah Lapine, CJDC-TV News, Dawson Creek.
Salon and barber services provided by Skinovations. Be swept away to a world of peace and tranquility at Skinovations Salon and Day Spa.